Welcome back to the NHSC site application process. Today we're going to discuss the clinical recruitment and retention plan. As always, everything that we talk about today can be found on HRSA's website and the National Health Service Corps section, and everything I reference is in the NHSC site reference guide. So the recruitment and retention plan, your site must maintain it and keep a current copy of the plan on site for review. So your site's plan should clearly state the policies and processes that your site will use to recruit and maintain clinical staffing levels. This is to, obviously to serve the community appropriately, and it should also include specific strategies to promote clinician resiliency and reduce burnout. So for just a little FYI, a solo private practice clinician recruitment and retention plan must include the following: recruitment and retention strategies for any potential expansion to meet community needs, strategies aimed at promoting clinician resiliency and reducing burnout regarding their own well-being, and contingencies should the provider no longer be able to serve the patients. So this is an example from the Appendix H of the site reference guide. So this is just a clear-cut example. Site ABC will recruit clinical staff needed to appropriately serve the community. So you would put in a couple of recruitment processes. So what's your, top, 3 or 4 processes or strategies to recruit, and then also retention. So what retention processes, strategies does your organization use, and put them in there. And then strategies to aiming and promoting clinician resiliency and reducing burnout. So some strategies, processes that your organization does as well. So it doesn't need to be super long. Usually some that I see are about a page or 2 long, but this is clearly needed, recruitment retention plan that clearly your organization has or doesn't have. You need to create one too. I will say, because some individuals will include this in the recruitment process section. They'll say, loan repayment, we are an NHSC site, but because you're applying, you're not quite an NHSC site yet. So that will actually disapprove your application if you aren't include that already in your recruitment process. That's just because you aren't an NHSC site yet. You're applying to be one, but does not mean you're offering loan repayment program yet if you haven't been approved. So that's just something that some sites have included, and also including on their logo, recruitment and retention or other posted signage. Sometimes they include like, we are also an NHSC site when they aren't yet, or, have that HRSA logo and that's kind of falsifying, even though yes, you are applying to be an NHSC site, but you haven't yet. So just a little FYI, of course, it can be part of your recruitment process and strategy once you are an NHSC approved site officially, but please don't include it anywhere before you are not one yet. So just a little FYI on that. So who needs to submit recruitment and retention plan? So those who are exempt are your FQHCs, FQHC lookalikes, Indian Health Service facilities, federal and state prisons, and ICE facilities. Again, don't need to submit, but with that asterisk, meaning that you do have to have some form of documentation of a recruitment and retention plan and on some type of document within your organization or site. Again, for those HRSA site visits, or if HRSA requests it, that you can forward on to it. So just again, FYI, if your facility doesn't fall under those exempt facilities, then you must submit a recruitment and retention plan. If you have any questions regarding this, please email me, and for any other questions within this presentation or for any of the other presentations.